specific individual, please make sure that you don't use any identifying information. Since this is going to go on the HCBS website, we want to make sure we keep all that out of the recording. Yeah, and I'll let everyone else introduce themselves on the team, and then we'll get started.
I'm sorry, Emily, can you introduce yourself one more time in case someone came in late and missed that?
Yeah, sure. I'm Emily Walsh. I am the new-ish home mod benefit specialist. I'm also the benefit specialist for vehicle mods as well as overcost containment and respite. So all those questions can come to me. Thanks for joining us.
Good morning, everyone. My name is Lydia Beals. I am a case manager generalist for the HCBS in the case management unit of Case Management Quality and Performance Division. I'm here to help you guys with the case management processes for home modifications. I'm also the person you would reach out to if you have questions specifically about case management role regarding home mods or the rights modifications that are required for home mods. I'll go ahead and pass it over to Naomi.
Sorry, I was trying to get myself off of mute. Hi, good morning, everyone. I'm Naomi Hubert. I oversee the home modification program here at Division of Housing. So I'm glad you could all join us. And I will turn it over to Ken.
Morning, everyone. My name is Ken Nider. I'm with the Division of Housing and the Home Modification Program, and I look forward to the presentation today. Thank you.
Awesome. All right, we'll go ahead and get started.
Okay, so I will get started then. So just real quick, excuse me again. So this particular training is for CCBs. We will have SEP training on Thursday. So if you are with a SEP and you do not administer or oversee the CES or SLS waivers, and you're more than welcome to stay on the call, obviously, but you do have a SEP training on Thursday. So just kind of want everyone to know that, so there's no confusion. There's enough differences between the waivers that we just don't want you to get confused. So just FYI. So what does HCBS, which is Healthcare Policy and Financing, and DOH, Division of Housing, what is it that we do? So back in 2015, Division of Housing, which is part of the Department of Local Affairs, and HCBS entered into an interagency agreement, and we agreed to help them with the home modification program or home modification benefit. So what we do here at DOH is we administer the day-to-day aspects of the home mod program, and we just make sure that everyone is in compliance with the rules and policies and regulations of that home mod program. And what HCBS does is they have the rules and the policies. HCBS also has a third-party agent that does all the billing and the payments for Medicaid services, not just for home mod, but for all Medicaid services. So if there are billing issues, chances are DOH, myself, and Ken won't be able to address or fix those problems because there is a third-party agent hired by HCBS to do the billing. HCBS still has oversight of the case management agencies. They deal with the appeals. They also are in charge of provider enrollment and termination. So if a contractor, home mod contractor, is bad, we at DOH cannot, quote unquote, fire them. Only HCBS can terminate a Medicaid provider. There's a program integrity that looks at those situations, fraud and so forth. And then also HCBS, as Emily mentioned, part of her role is to review vehicle modifications and AT requests. So here at DOH, we only review the home modification requests, not vehicle or AT. Okay. So what is the home accessibility adaptation? So this is taken directly out of the rule. Again, this pertains to SLS and CES waivers, not EBD or SCI or CHMS or BI. This is SLS and CES waivers. This is right out of the rule. So the home accessibility adaptations would be what's considered, or what we would look at to be the most cost-effective modifications. Based on that person's medical condition or their disability, it's necessary for them to be healthy and safe in their environment, or to provide them with greater independence or to prevent institutionalization. So this is different than what we see in the other waivers, the criteria. So that's why I want to be sure that people don't get confused between the waivers. But there are the links to the rule, so you can have that access to the rule. Okay. So how much funding is available? So for the SLS and CES waivers, there's a $10,000 benefit that renews every 5 years. Now, this benefit covers home modifications, vehicle mods, and AT. So if somebody got a vehicle modification last year for $5,000, then they only have $5,000 left for home mods. It's not $10,000 per home mod, vehicle mod, and AT. It's all combined, and it will renew again July 1st of 2024. That is the 5-year mark. Okay. So what if a modification costs more than $10,000? So the rule does allow us to go over the cap. There is additional criteria that has to be met. So in addition to the previous criteria, the member would also have to, it would have to be determined that they are at immediate risk. Now, so an immediate means like immediate. So if they've been living in that environment for 5 years without, risk to their health or safety, then it's not an immediate risk. Or there's been a significant change in their needs since the previous home mod. So let's say previously the individual was ambulatory and they could walk and they just needed easy steps. But as time has gone by, their condition has deteriorated or has evolved into the situation where they now need to use a ramp all the time. And so obviously you can't use a ramp on easy steps. I mean, a wheelchair on easy steps. And so we would be able to go over the cap to build them a ramp. Any questions on that?
No questions in the chat.
Okay, cool. And somehow I just got myself off of the presentation. Sorry. Oh, very good. So what settings are eligible for a home modification? So rental property, yes, we can do home mods and in a rental property. That is part of the rule. We would like to look at things that are a little more portable or less permanent, because if they move, they've already used that home mod money in that rental property. They don't get another set of $10,000 for a new rental property. Congregate housing, no, we cannot do home mods in assisted living, nursing facilities, group homes, host homes, things like that. That is in rule. Federally subsidized housing, again, no. So this would be housing that is where the property owner, and this is typically going to be like an apartment complex, where the owner of that apartment complex is getting federal funds. If they're getting federal funds, then we cannot use Medicaid home mod funds. They are required already by the Rehab Act of 1973 to not only allow the modification, but they have to pay for it. If you're not sure of this, if a person is living in federal housing, federally subsidized housing, please just shoot us an email or phone call and ask us and send us the address, and we can do that research for you. So, and just FYI, we are not an enforcement agency. So if a landlord that is required to do the modifications doesn't, we can provide education and information to that landlord, but we can't make them do that modification. Okay. So what can case management approve? So home modifications that are 2499 or less, yes, you can approve those. You can approve the installation of DME, but not the purchase of DME. There is a separate DME benefit under the state plan to purchase DME. Repairs to an existing modification and service calls. We get this question a lot. Yes, you can approve repairs to an existing home modification, regardless of who paid for that home modification. If another agency built a ramp 5 years ago and it's fallen apart, Medicaid funds for that individual can cover that repair. We can also cover the cost of a service call. Someone's VPL isn't working. Someone's stair lift isn't working. In order to find out how to fix it, the technician has to go out and look at it. They're not going to do that for free. That's a service cost. So yes, you are able to do that. Repairs to a bad home mod, that is a no. And by that we mean, let's say that a home modification provider, whether it's the CCB or an enrolled provider, let's say they built a ramp last October and they didn't do it right and it's fallen apart or doesn't meet code. That is the responsibility of that contractor to get corrected. So you cannot approve repairs to a bad home mod. We would need to know about that, because then that just starts the whole process of us doing an investigation of an inspection to determine, like, you know, what did the contractor do wrong and what it is that they need to fix. So all of that, and that's because all the home modifications are under a 1-year warranty, so they would be responsible for getting that correction. General home repairs, no. Somebody calls you and says their dishwasher doesn't work, their refrigerator went out, their roof is leaking, we had a storm last night, a tree fell and broke my front window. That is not a home modification. Okay. And then again, modifications in federally subsidized properties, no, it doesn't matter the amount. Even if it's less than 2499, you still cannot approve modifications in a federally subsidized property. And then change orders to an existing home modification. Like I said, we approved a project, the contractor calls you and says, hey, I need a change order. I need to fix more rotted wood or more subfloor or whatever the case may be. All change orders have to come to the state for review. Case management agencies, CCBs, SEPs, you cannot approve change orders. If you approve a change order, the contractor moves forward with that approval, we can come back later and unapprove it. And then someone's stuck with paying that, and it wouldn't be Medicaid. So please do not approve change orders. Do we have a question in the chat box?
We do. Mary Ann Peterson is asking, does the cost of a repair to a home mod or service call fall under the $10,000 limit? So if the home mod used all of the benefit, would the repair not be covered, is the question.
That is correct. It is included in that 10,000 limit. Yes. And again, like we mentioned earlier, you can request to go over the cap, but that's going to require the additional criteria. And then later in the presentation, we will discuss the use of Arpa funding, but we will get to that later in the presentation. So what do you need to remember as case manager? So the OTPT evaluation is not required for home mods that are 2499 or less, but we highly recommend that. The OTPT could go out there and find other areas of the home that maybe the client wasn't aware of. A lot of times folks with disabilities will adapt to their environment and they get used to not having a modification and may not be aware. And the OTPT might point it out and say, hey, you know, you could do easy steps here and it would be easier for you. So although they're not required, the evaluation is highly recommended. All modifications, again, must comply with rule, and there's the regulations cited there. You must verify that they have adequate funds. If you're not sure or unsure of how to verify that, you can send us a question, an email, and ask us, you know, how much funding does this person have remaining? The home modification expenditures, remember, are cumulative during that 5-year period, or during the certification period, excuse me. So someone's certification period, their service plan year is January 1st of 2022 through December 31st of 2022. They get a home mod in January for $1,000. You're able to approve it. It's under that cap of 2499, but they come back later in July and they ask for a $2,000 home mod. You're thinking, oh, well, that's $2,000. That's less than 2499. I can approve it, but you can't, because the 2,000 plus the 1,000 is 3,000, and that puts you over that 2499 threshold within that person's certification period. So keep that in mind, please. There is a home modification checklist that we do encourage you to use. It's a helpful tool. Later in the presentation, Ken will go over what you all have to send in, and it looks like a very overwhelming list of documentations that we need. So in order to kind of lessen the stress and to make sure that you do provide that information, there is a checklist to help you provide the information that we will need. But we'll go over that later. Okay.
Naomi, we did have an additional question in the chat. I think it's still related to that repair question.
Okay.
So Laura Spicer says, if a home mod exceeds $10,000, but it's not an immediate danger, how do you prioritize repairs? Is that allowed?
Well, they wouldn't have the funding to cover it, so there is no way for us to prioritize it. If going over the cap, if that requirement can't be met, then we can't go over the cap to do that repair. And again, we'll speak a little bit more about the ARPA funding later in the presentation that we could access. But if there is no ARPA funding, which isn't always going to be the case, then and they're not able to provide the documentation to justify going over the cap, then that we wouldn't be able to do that repair, unfortunately. So
let me take over for a minute.
Yes, ma'am.
All right. So we wanted to make sure and call attention to folks that work with home modifications and CES members. It's important for everyone to remember that anyone enrolled in HCBS CES are eligible to enroll into an adult waiver on their 18th birthday, and this includes a prioritized enrollment to the HCBS DD waiver, bypassing the wait list. So this is important for you to think about because in the HCBS DD waiver, there are no home modifications allowed. So if a member is interested in having their home modified and planning to live there after their 18th birthday, we really want case managers to be having these conversations with families early on. So, and I know we say 18th birthday is the deadline, but that also means that the home modification would have to be completed and billed for before that end date of their 18th birthday. With the state of the world and the pandemic that's going on right now, we're seeing a lot of lack of supplies for construction projects and a lot of waiting times for contractors. So I think before, when I talked about this in training, we suggested planning for home modifications prior to their 17th birthday. And at this point, I would definitely suggest having those conversations early on when these members are 15, 16, talking about what the family is thinking the member might benefit from once they turn 18 as far as waiver services and if home modifications are needed, because we cannot approve any home modifications for a CES member and pay for it if it's not completely completed before their 18th birthday. If there's any questions about that, I'd be happy to speak to that as well. And we'll have time for questions at the end too. So if you have more as we're going, feel free to put them in the chat. You can go ahead to the next slide, Emily.
Oh, that one's fine. Okay, so home mod process under 25, that 2499 threshold. So the need for the home modification is identified by the case manager, case management agency. You know, someone calls you and says, hey, I need a ramp or, you know, a walk-in shower or something like that. Please remember to, again, just emphasizing that you've got to get that process started early for someone that's going to be turning 18, because once they're 18, we cannot cover the cost of that home mod, and we don't want a contractor to not get paid. That's not good. So please keep that in mind. If it looks like what they're requesting is going to be less than $2,500, you know, that 2499 threshold, they're asking for an accessible toilet or, you know, a small ramp or grab bars to be installed, you know, then yeah, that's okay. But if they're asking for a walk-in shower, a walk-in tub, a roll-in shower, that's obviously going to be more. So then you would have to follow the process of a home mod that's over that threshold, which we will go over in the next few slides. If it's going to fall under that threshold, then once again, you do not have to get the evaluation. It's not required, but it is very highly recommended. Follow your own agency's processes for obtaining bids and for reviewing those bids, and just keeping in mind that the most cost-effective option is what we're looking for. And then once you do approve that home mod, it needs to be added to the PAR in 2 units. If you're not sure how to do that or not sure how to get it onto the PAR, you can always ask. And then depending on who is acting as the contractor, whether it's the CCB or the enrolled provider, that's the person that does the billing. So if you're a CCB and the enrolled provider is doing the work, do not bill, because that enrolled provider can do their own billing. That is very confusing and contractors get upset. So if you're the CCB and you're using a subcontractor who is not an enrolled provider, then you can do the billing. Okay, so there are some questions in the chat.
Yes, there are. So Emma Kate Davis from Envision asks if there is a list of contractors that can bill PARs directly.
No, we don't keep lists of enrolled providers, simply because if for some reason we miss a provider or a new one comes on board that's not on that list, it can look like we're not trying to promote them, or if you know what I'm saying, we don't want to look like we're steering people to use particular contractors. You can go onto the HCBS website and you can look up home mod providers that way. Your agencies, though, should have a list of contractors by now. We've been doing home mods for quite a while, so you should have a list of the enrolled providers in your area, and then also the ones that aren't enrolled that you typically use, because some of you CCBs don't use enrolled providers all the time. I've seen contractors that aren't enrolled, so I would highly recommend that within your agency that you develop these lists and keep them updated with who is an enrolled provider.
And I would also reiterate that if you're struggling to find a provider in your area, you can reach out to Emily or the DOH team or myself to ask for support looking for contractors, and we'll be happy to connect you with somebody. And then we also have Mary Phillips asking, 2 units into 2 separate lines, or can it be 2 units in 1 line of service in the bridge for projects that are under 2499?
That's a big, because the rule applies to the modifications that we review. I mean, you can put them on there. However, it's going to be less confusing for the CCB to put on there, but you do need to have it in 2 units because that's how they get paid. I know it's a confusing answer. I apologize, but since DOH only reviews those that are over that amount, the processes and procedures that we have only pertain to those amounts of home mods. But home modifications per rule are paid in 2 units. So you can put them on 2 separate lines if you'd like, or you can put them on 1 line. Okay, so it's time for a test, a quiz. So case managers, you are able to approve anything as long as it is 2499 or less. And you can type true or false in the chat box. Okay, good. So yes, the answer is false. All home mods, regardless of the amount, still have to comply with the rules and regulations. So you can't approve anything just because it's less than 24. What if they ask you for a TV that's less than 2499? That's not a home mod. So it still has to comply with all the rules and regulations. And then OTPT evaluations for home mods that are 2499 or less are not required. Is that true or false? Awesome. That is true. Although they're not required, though, we still highly recommend that you get the evaluation. Thank you. All right, so what about home mods that are over that threshold of 2,500? So the process is kind of the same. So the need for the home modification, again, is identified. Somebody calls you and says, hey, I need a ramp, a walk-in shower, a roll-in shower, whatever the case may be. Again, be mindful of someone turning 18 years old. And then the OTPT evaluation is required, and it is scheduled with that member. That evaluation is then completed and sent back to the case management agency or back to the CCB. And then at that, based on what is being requested by or recommended by the OTPT, the case management agency, then you can determine whether or not a rights modifications will be needed. And Lydia will go over that in more detail. And just a friendly reminder, and I think I'll go over it in the next few slides, but I'll say it here as well. The recommendations for the home mods have to come from an OTPT or other approved professional. We continue to get narratives from case managers saying why the client needs a home mod, or a letter from the mom why the client needs a home mod. Unfortunately, we can't accept those. Please keep in mind that the recommendations have to come from those other professionals. The evaluations and the bid requests are then sent to the contractors that you're going to be asking. Prior to getting the bids, if you have any questions about what is being recommended by the OTPT, maybe they're recommending a swimming pool or, something like that, and you're not sure if it's going to get approved, you can send that evaluation to us prior to getting bids so we can look at it, kind of nip it in the bud. But you don't have to. That's just an option. The contractors then, based off of that recommendation, they submit their bids to the CCB. Based on those bids, the amount of those bids, then you can determine whether or not over-the-cap request is required. And then again, later in the presentation, we'll go over the Arpa funding. That completed home mod packet is then sent to DOH for review. If there's documentations missing, we will send it back to you and say, hey, this piece of paper is missing or this form is missing before we do the review. So please be sure that you send completed packets. And again, Ken will go over what that list is. When the home mod has been approved, then all parties will be notified of that approval. The contractor can begin the work, and then the work is done. Everybody's happy. And then if applicable, if needed or requested, we can do an inspection. And again, case managers, you can send evaluations over to DOH for us to review before you get bids if you have any question about what is being recommended by the OTPT. And again, OTPTs have to complete that evaluation or a HCBS approved qualified individual. So if you don't have an OTPT in your area, or maybe the modification is based more on a behavioral need as opposed to a physical need, and maybe the OTPTs aren't qualified to make that recommendation and you have to use a behavioral therapist, you can just let us know, hey, this is the situation. Are we okay to use this other type of therapist? Or if you live in a rural area or it's just hard to find someone to do that evaluation, please let us know and we can hopefully get someone, to do the evaluation or determine if another professional is qualified to do that evaluation. They do have to be completed on that Health First Colorado Home Modification Evaluation Form, which is on the website, I believe. I am working on doing a training specific to therapists who do the evaluations. I'm hoping to have that ready in August. And we will go over how to use that form with the OTPTs and the other professionals that would be doing that. The recommendations, again, would have to be based off of the member's individual needs, not what they want, not what grandma wants, not what the caregiver wants, definitely not the contractor's opinion. We cannot accept a home modification evaluation that says per the contractor. That will get sent back. Contractors don't make recommendations. And they have to be completed in the home. I do believe, though, that because of, I think we're still looking at or having COVID precautions, I believe that HCBS is still allowing for the telehealth or the virtual evaluations to be completed. Those aren't as good as being in the home. So if at all possible, we do want to respect a person's, request, to not have people in their home to do the evaluation because of COVID. But at some point, the contractor is going to have to be in the home. So if we can do that evaluation in the home, that would be best. Okay.
Naomi, I just wanted to let everyone know that I did put a link in the chat for folks to be able to find their local RAE for their area. So if you're struggling to find an OT or a PT who can do an evaluation for your members, please reach out to your local RAE for support with this. And if that is unsuccessful, I would like you to email me directly so that I can follow up and make sure that we're figuring out how to address that issue. And then we did get some feedback from Laura Spicer, and she says that the form I got back has type issues. The text is too small to read in some fields. How can I fix that? And Laura, if you wouldn't mind maybe telling us which form you are talking about. We have been updating them, and sometimes there's some errors when we test it. So we'd be happy to take a look at that.
It was the OTPT Home Modification Evaluation Form from DOLA.
Okay. We'll take a look at that and then reach back out or let you know at the end of training. I'll take a look at it while we're working on this.
The home modification providers. So CCBs, you are able to bill as a provider of record if you're working with a contractor who is not an enrolled provider. That is your choice to make as an agency. If you are going to go that route, then the CCB is the contractor of record. So if there's any issues with the quality of the work, it falls on the CCB to get corrected because you're the contractor and the company doing the actual work is the subcontractor. So just keep that in mind. You're responsible for maintaining your own list of local providers that you can work with. And again, if you're having problems finding anyone at all that's an enrolled provider, you can let us know, and we can help in that situation or try to help you in that situation. Oh, there it is right there. Sorry. And so we can work with exploring other options. Okay. I think this is the rights modification ones. Yes. Okay.
All right. Sorry, I don't know why the title's not on the top of it, but we're going to talk about rights modifications and informed consents. So we wanted to remind everyone that documentation of a rights modification is required for any home mods that restrict a member's rights. This is applicable for all members participating in the HCBS waiver programs and electing the home modification benefit. So we did link in some memos that are the most recent communication about rights modifications and the link to the informed consent. We wanted to remind everyone that rights mods and informed consents must be reviewed by the interdisciplinary team at least every 6 months. Informed consents must be signed annually by the member or guardian. They also require a referral to a Human Rights Committee review and a recommendation either initially or annually with HRC. So we don't expect for case managers to have a completed HRC review when they submit a home modification packet, but we do want to see the informed consent. So that will go with the packet to DOLA, and then I will review the informed consent. If there's any questions or follow-up needs for those, you'll be hearing directly from me. We did want to put in the information about the age-appropriate guidelines in here so that you can also check that out for members that are on CES. Sometimes we need to look at those before we're able to approve the home modification or the informed consent based on the member's needs. And then we also have the links to the rules down here for the final settings rule and for rights modification specifically with IDD folks so that you can check out those rules as well. Do you want to do the next slide, Emily? So we wanted to kind of talk about when is documentation of a rights modification required. So here are a few examples requiring documentation. A locked or alarmed fence for a yard to prevent a member from eloping. So a fence in the yard does not necessarily require a rights modification. It would only be if there's something added to the fence to prevent that member from being able to leave the fenced area, as anyone might be able to. Also, locks for a refrigerator or cabinets in the home to prevent excessive eating based on diagnosis would also be considered a rights modification. This is not a comprehensive list of home mods that constitute a need for a rights modification. Feel free to look at some of our rights modification trainings and materials that we've selected in here if you'd like more information about that as well.
Okay, so the bidding process. So the bidding process for CES and SLS waivers is you have to solicit bids from at least 2 contractors, either enrolled or a subcontractor for the CCB. They do have to use that bid form. We continue to still get bids, you know, on other forms or other pieces of paper or whatever. The enrolled providers, if they are an enrolled provider, they know to use the bid form. They've been using the bid form since 2015, so there really isn't a reason why you should be getting bids from enrolled providers not using the bid form. If I've provided the most recent updated bid form to all of the enrolled providers, so they have that information. If you would like a copy of that, I can send that to you. Just email me later and I can get that over to you, because the subcontractors would have to use that bid form as well. They have 30 days to submit their bids. If after 30 days, only one contractor has responded and the family is okay or the member is okay with using that one contractor, you don't have to keep trying to get that second bid unless the family or member wants to keep trying for bids. Again, we continue to get home mod packets that are 6 months old because, you know, the case manager was trying to get that second bid and nobody would bid. You don't have to do that after 30 days. We don't want to hold up the process anymore. So as long as the client family is okay with that one bid, we can move forward. They have to follow the OTPT's recommendations. So that is why we ask that if you do have any questions about the evaluation, that you send those to us prior to getting bids. The contractor should also be addressing any kind of code-related issues or permits, structural issues. We don't expect the OTPTs or other people doing the evaluations to know this. That's not their area of expertise. They're not contractors. The contractor should know this and should be including this information in their bids. So if they don't have a contractor preference, you get 2 bids, 3 bids, 5 bids, whatever. The lowest bid is the one that we're going to look at to review for approval if they don't have a preference. Okay. And then the home modification packet.
Okay, so Naomi has been talking a lot about the process, right? How to go about doing home modifications, whether it's above or below 2,500. Once you've gathered all of that information, the documentation, etc., these are the items that you'll need to send to us for review. And again, please submit all initial home modification requests to that email address, dola_homemod@state.co.us. That's where we go and look for those new requests and grab them and start processing them. So first off, we would like to know, obviously, the person's name, but their client or member ID is very beneficial for us, because that's a key item that we use to research that individual, what their benefit is, if they've used any prior funds, etc. The statement of understanding form, we would like to see that as well. That document just sort of lays out what's the process is going to be like, some of the responsibilities of the client during this process. The evaluation by the therapist or other approved professional, and that would be all the evaluations that were completed. Oftentimes, we will receive an addendum dated today, and it will reference 2 prior evaluations that were completed maybe over the last 6 months. And they'll say, please refer to the original. So if we don't receive those original evaluations, you're going to get a response from us asking for that additional information. Again, same with the bids. All of the bids that you obtained, we would like to see those, along with who is the client's preferred provider. So if you ended up getting 2 or more bids, we'd like to see those 2 bids, but please let us know who the preferred provider is, because that's the one that we'll then move forward with in reviewing. And again, pictures, drawings, etc. There's one contractor in particular that will always write in there, if they're doing a ramp or something, it'll say, please see attached diagram. And the diagram somehow never seems to get to us. So again, it's just another delay in the process, because we're going to ask for that diagram. The consent forms. So there will always be a consent form needed for every home modification request. And if you are the owner of the property, then the consent form will come from the owner. If they're in a rental property, then the consent form is going to come from the owner of that rental property. There are other situations where consent forms may be needed if they're in a condominium complex, for example. You may need to get a consent form from an HOA or a condominium board, something along those lines. An example of this would be, let's say it's a multi-story condominium unit and they live on the middle floor and a roll-in shower is being requested. If there's a concrete subfloor under there that they need to chip out, well, that's obviously going to disturb the neighboring units. And so the association would need to provide a release at that time as well. Okay. Mobile home parks. Okay, so when it comes to mobile home parks, if a client resides in a mobile home park, we are going to need a consent form from the owner of the mobile home itself. Then if exterior modifications are being requested, a ramp, a VPL, whatever it is, then at that point, we're also going to require a consent form from the owner or manager of the home, mobile home park as well. And that, so there's unique situations there, but keep in mind, there'll always be a consent form needed no matter what. The question is our additional consent forms needed? And that really depends on each individual situation. Lydia discussed rights modifications and the paperwork that is required for those. Okay. If you are looking to exceed the cap, we need to know what it is that the client or family is wanting to do. So Naomi discussed about a $10,000 benefit. If a request comes in at $12,000 and there's no explanation, it just says, here's the paperwork and there's bid at $12,000, you're going to get a question. How do they want to address the amount over $10,000? If they want to use ARPA, the American Rescue Plan Act, the benefit under that, then they need to inform you of that decision, and you need to pass that information on to us. And this could be as simple as an email. So in other words, you talk to the client or the client's family, and you let them know you have $10,000 benefit, but the bid is $12,000. What do you want to do with that extra $2,000? Are you going to make an over the cap request? If you're going to make an over the cap request, then you'll need to provide supporting documentation that meets over the cap requirements. It's a high bar to meet, so we don't often see over the cap requests granted often, because it is a high bar to meet. But if they can meet that, then that would provide them the greatest benefit, right, over the cap. If they're going to go through ARPA, again, when you're sending in the documentation, if you can just type in there, client Joe Smith would like to use ARPA funds for the amount above their cap. Okay. We'll talk about ARPA here in just a second. And then, of course, all of these forms can be found on the HCBS website. We are in the process of updating forms. The current forms should be there. And then as we continue to revise and update forms, they will be added, and notifications will be sent that there are new forms to be used. Okay. So this slide here, if you wanted to know what needs to come to us, this would be a great slide to either take a screenshot of, print out later, however you want to remember. But this is the #1 reason that you will receive a response from us, is that something in here is missing. And if something is missing, it basically puts the entire project request on hold until we get that documentation, and then we will move forward. And I'll give you an example. If you send us a request and there is no consent form, then there's no point in us moving forward, because if the homeowner doesn't consent to anything, the home modification would not be approved. Okay, so just keep that in mind. Any questions on this? Documents that need to come in? Okay, next one. All right, so quick little quiz here. True or false? All initial home modification requests over 2499 must be sent to dola_homemod@state.co.us. What do you think? True or false? No? You guys are welcome to shout it out if you don't want to type. Mm-hmm. Okay. Somebody.
True.
Thank you, Naomi. So the answer is true. Right? So if it's 25 or more, you need to send those initial requests to that email address, and that's where we will grab them and start processing them. Okay. Next. Do we have one more question? We have looks like we went through. So true or false, if the member owns the home, a landlord consent form is not needed. What do you think? Well, a consent form is needed, right? So it's either a homeowner consent, landlord consent. Some type of consent is needed from the homeowner in order to proceed with the home modification request. Okay. And then the answer is already provided there, but the last question, it is required to send Health First Colorado home modification evaluations to DOH for review prior to soliciting bids. And as you can see there, that is false. You do not need to send the evaluation to us first, although you are able to do that if you would like. And what that is, if it's an unusual request or it just seems out of the ordinary and you're not sure, you're welcome to send the initial evaluation, and we will take a look at it and we can provide guidance. Yes, it looks good, or they're going to need to provide additional clarification, or what is the reason that more information is needed. Okay. All right, so the approval process for the mods that are 2,500 or more, you and the contractor, if they're an enrolled Medicaid provider, okay, so the case manager and an enrolled Medicaid provider will receive an email, and it comes from the DOLA home mod at state.co.us email address. The subject line will say approved PAR. In the parentheses there, that P0000, that will actually be the project number within Salesforce. So that will be a specific number there. And it'll have the client's initials. The body of the email will contain a link to the portal where you could then access the approved PAR, etc. And we'll talk about the portal here in a second as well. Okay. So we ask that you not forward these notices to other people. Now, if you are using a provider, so the CCB is acting as the contractor, and then the actual worker person is going to be a subcontractor. At that point, the CCB will need to notify that subcontractor that it's been approved and you go ahead and get started. And you'll see that in the email. The subject line will show who the parties were that received the email. So just keep that in mind. There's a little distinction there, depending on what type or the contractor using, if they're enrolled or not. Okay. Why is that important? Well, if they do work on a project that was not approved, both the agency and the contractor could be held financially liable for those items. So that's a situation we'd all rather not see. So if there's any questions or you're not sure what to do, please let us know, and we'll follow up with you with some more instructions. Okay. All right, the portal. This is what it looks like when you get to the portal, the DOH portal. The vendor is called Salesforce. So once you actually put in your username and password and you log in, this is what you'll come to. Okay. Now, keep in mind, the way that Salesforce has set this up is that only one case manager can be assigned to a project. So if you are in there looking for a project and you can't find it, chances are good that you are not the assigned case manager. So we see this oftentimes with management. Managers want to go in and check on the work that their case managers are doing. That manager could not access the case manager's projects because it's set up one per item. Okay, so keep that in mind. On the left side, you will see the project name. That will be an actual person's name. If you don't see them there, there is a search field. It's highlighted there in yellow. You could type their name in and find it that way. If you still cannot find it, then you need to let us know. It might be us that have misspelled that person's name, or maybe you are the new case manager coming into that particular project, and we need to update the assigned case manager. We'd also ask that if you know you are leaving, to let us know about that and who is going to be your replacement. So this might be more geared towards managers. If you know that one of your case managers will be leaving, let's say Joe Smith is leaving, but Jane Smith is coming in to take their place. If you let us know about that, then we would be able to run a report with all of the projects assigned to Joe Smith, and we could get all those transferred over to Jane Smith. Okay, so just keep that in mind. Next.
Ken, we did have a question in the chat box. Laura Spicer is asking, how do we get a username and password?
Sure. You would send me, or if you want to send it to that generic home mod email box, really what we need to know is your contact information. So your name, phone number, email address, and then we can add you to the portal. And then we will activate you within the portal, and you will get an email message from Salesforce to establish a username and password.
So I'm sorry, Ken, just a quick reminder. If you don't have a home mod project that you're working on that you've sent to us, when you log in, you're not going to find anything because you're not attached to any project yet. So just keep that in mind as well.
Right. So you have access to the portal, but you don't have access to any project. And so we, as an example, we see this from management. Management will send us, one of your agencies will send us an email saying, we've got 3 new case managers coming on. Here's their name, email address, phone number. Please add them to the portal. We will go in and add all those individuals to the portal. Each one will get a distinct email from Salesforce asking them to set up a username and password. And now you have access. You don't have any projects to look at, but you can get there for when you do have a project, you'll already be set up in the system. Okay. So once you've accessed a client's project, this is part of what you will see. On the left side there, it says project name. That will actually be the person or the client's name. On the right side, where it talks about completion dates and upload files, etc. The upload file section, you can actually upload a document directly into a project. So if we're asking you to send us something, you could actually upload it directly into that client's project and we can see it. So if we ask for a consent form, you can send it directly to us. You can send it to the generic box. You can upload it directly into that person's file if you would prefer, whatever's easiest. Okay. Always, this is where contractors, when they are done with their project, if they're an enrolled Medicaid provider, they can access the portal as well, that particular project, and they will upload their completion documents. So there will be lien releases, warranty documentation, pictures of the completed work, etc. And they need to provide that information to us so that we will approve that second unit. Okay. And that's something that we talk with providers during their training on as well. Next page, please. Okay. So again, in here, you have access. Once you're assigned to the project as a case manager, you have access to that project. And in the progress notes, so you will see they're circled. One says construction progress notes and one says PAR progress.
You're muted, Kim. Ken, you muted yourself.
Sorry. So the progress notes, you have access to this project and you can see what is happening. So if you email me for a status on somebody, I'm going to access the portal and I'm going to review these notes, and then I'm going to respond to you and say, we're waiting for X or Y, whatever it is. To speed that process up and to be more efficient, you can access that project and read those progress notes as well to see exactly what we're waiting on. Okay. And then we're all different in how we do those. But I typically will put case manager and therapy notes under the PAR progress area. And the construction ones will be anything related to the contractors themselves. Okay. Completion dates. So expected completion dates is once the project is approved, it defaults to 90 days out. And that is based on the rule. And we'll talk about that here in a minute. If the contractor is unable to complete the project within 90 days for a valid reason, they will submit an extension request to us with what is the reason for the extension request and what is the end date they're looking for. And we often get these due to supply issues, labor issues, maybe the client was sick and couldn't have people in their home for a little while or something. So all that pushes the project out. Okay. At the bottom there where it says date approved, date PAR approved by DOH, that date field is entered by us. So if you see a date field in there, that means that the Division of Housing, us, have actually entered in the date that this was approved. That's when you should see the corresponding email. All of it should be with that same date on there. Okay. All right. Next one. Got little arrows there. So denials. Okay. So oftentimes we'll receive requests where we are not able to approve them either in whole or in part. If that happens, we are going to notify you of what we are not able to approve, and we're going to provide you with the citation. Okay. And then that's when that 803 notice of action, you will send that to the client and the reasoning for the denial. And then they have the right of appeal. If they want to follow that line, they may do so. Okay. All right. So now we get into contractors and what they do. So after they get that approval notice from us, by rule, they have 60 days to start a project. Once they actually start the project, they have 30 days to complete it. So that's where that 90-day timeline comes into play. Now, keep in mind, they don't have to wait 60 days to start. If they want to start same day or next day, by all means, please have them do so. But just know that they have 60 days to begin. Okay. There's the extension requests if they need to do that. And then the bids. right? As you've seen, a lot of you have seen, you get a bid, it comes in, and we're looking at it and we're saying, okay, X, Y, and Z, we're unable to do, but A, B, and C we can. So we're going to ask contractors to revise their proposals. And once everything is good and there's an approved bid, the contractors should be reviewing the actual approved bid with the client. And there is a new bid form. And on the bottom of that form, there are now areas for the client or homeowner to sign that bid, acknowledging they've reviewed it and they're in agreement. Okay. And then this is all part of the training that we do with contractors, so they're aware of this process as well. Okay. Change orders. Remember, all change orders, regardless of the dollar amount, must come to us for review and approval. Whether it's $1, thousands of dollars, whatever it is, those change order requests need to come to us for review. Okay. The 1-year warranty is what contractors must provide. And actually in rule, it says a written 1-year warranty. And so when contractors are coming back to the state for that approval of the second unit, in that uploaded file section, they will be uploading a copy of that 1-year warranty as verification that they provided that to the client. Okay. All right, complaints. Unfortunately, this does happen. And if it does happen, the first thing we want is for the contractor to be notified of the issue so that they have an opportunity to address it, especially if it's within that 1-year time frame. If there's an issue during construction, we definitely want to hear about that. You know, the contractor showed up hungover or is using profane language or whatever it is, then the sooner we know about it, the sooner we can take corrective action as well. But really, the contractor needs to be advised that there's an issue, what is that issue, and the opportunity to fix it. Okay. All right, then you let us know about it. Okay. All right, that inappropriate behaviors. I mean, where this comes in is sometimes we will actually get, it'll be 2 years after the fact, and we will then get notice that so-and-so was not professional when they did the work. Obviously, we'll address that issue with the contractor, but it's now 2 years down the road, so we're limited in actions that we can take. Okay, so really it's timeliness on all these. And then complaints. So items that rise to the level of a complaint will be inspected. Okay, and we have an inspector, Nikki is her name. She covers the entire state of Colorado. So keep that in mind, that she's not always in certain areas at certain times, and there might be delays in getting those inspections completed. Myself, Naomi, we also complete inspections. However, we mainly stick to the Front Range, and Mickey travels kind of the outlying areas or the Western Slope, things of that nature. And then if an item is inspected, a report will be made, and you'll receive a copy of that report so that you can see what happened as well. Okay. Keep in mind that a client can choose to have a different contractor complete the repairs or problems or whatever it was. Now, that can raise some other issues. It is oftentimes very challenging to find another contractor that will come in behind somebody and fix their work, okay? For whatever reason, could be insurance-related reasons for them, liability insurance, or they just don't want to get involved. What we'd really like to see is the original contractor make things right, but if there are just issues that prevent that from happening, then they can choose a different contractor to fix it, okay? All right, ARPA, everybody's favorite subject these days. So ARPA can provide up to an additional $10,000 in home modification funds. So if a client has not spent any of their waiver benefit dollars, whether that's in home funds, vehicle mods, assistive tech, et cetera. They've got that full $10,000 limit. Now ARPA comes in on top of that, so they could have potentially up to $20,000 in those funds. And ARPA is available for those with an eligible waiver. CES and SLS are eligible waivers for that, okay? Any home modification request that involves ARPA funds, whether it's a penny or the full $10,000, must come to the state for review and approval, okay? And as I mentioned earlier, if a client is wanting to use ARPA funds, they need to inform you of that decision, and you just pass that along to us, and that can be accomplished in your initial email, separate line, client would like to use ARPA, okay? So again, there's several options that they can pursue if they need more money, and we will try and find them that extra money if possible, okay? And then again, when it comes to ARPA, the home modification waiver benefit must be fully utilized. So in other words, if they've got that base $10,000, that full $10,000 has to be spent before we can get into ARPA money. Okay? Questions about ARPA? I'm opening it up to the floor. Questions, how that works. You often get questions, how do I access those funds, or where can the client access those funds? There is nowhere to access it. You basically let us know that they would like to use it, and then we factor that in when we're reviewing the request. Okay.
I think there might be, there we go, one more bullet point.
And it's available until March of 24. As we get closer to that date next year, notices and reminders will start being sent out because there's a hard deadline with ARPA funds. So in other words, if we're approaching that deadline and a request comes in 3 weeks before, it might be a request that could be approved, but because we're going to hit that hard deadline and the project would not be complete, it would not be approved at that point. Okay.
We have a couple questions in the chat.
Sure.
The first one is from Corey Canty from DDRC. Is the ARPA funding an additional $10,000, or does it just increase the cap within the waiver SPAL?
Okay. So two things here. There's the CES and the SLS waiver are slightly different when it comes to this limit. There's a hard limit on the CES waiver. I think it's 52 to 54,000, depending on where they're at. That hard cap cannot be exceeded. So when you're looking at the authorized SPAL limit and it says 54,000, if they already have spent 45,000, okay, it doesn't matter what the request is, there's that hard limit there. But if you want to use ARPA, essentially you can reduce the amount spent by 10,000 to free that up. It gets complicated in there, but just know that it doesn't mess with the SPAL limits. It's just in how we can allocate the dollar amounts. So if you're doing over the cap request, part of that is going to say what benefits are being reduced on a long-term basis. So if I get this shower modification, these long-term services will be reduced because we're getting this shower. And so that's where you get into over the cap items and this and that. And it just gets kind of confusing there, especially with SLS waivers, because technically you can exceed that cap. So Lydia put in there 54.6 or 55.5. So SLS, we can exceed that hard number, but CES, we can't. So just know this. When you start getting to these requests and they're high dollar amount requests, if we're going to run into limit issues, there will be more follow-up with you regarding the number sequences. The goal is to get these approved with the available funds that are there, either the waiver plus ARPA or whatever it is. And so it really depends on that request is how we're going to tackle or address the dollar amounts. So sorry, that's kind of a long-winded explanation there, but because it's different for each waiver, it's a different explanation. So.
Can I ask a clarifying question?
Sure.
So if I have an individual that's already utilized, let's say 45,000 of the 54,000 for CES, and the home mod comes in at 12.5 for the bathroom and the ramps, so that would be over that. Well, first of all, it's over the 10, but even if it's let's say there's only $7,000 unused in their CES plan and the home mod comes in at 9. Mm-hmm. There's not enough money in their plan year unless they stop utilizing other services, which they need.
Right. So in that case, that $2,000, is that the question? What do we do with that $2,000?
Right.
Okay.
Can ARPA be used for that? Because then it would put the total amount spent for that individual, including home mods, over that $54,000 hard cap for the year, including all the services.
Yes, ARPA can be used for that. Yes.
Yes. So in other words, you're going to be using ARPA to reduce that 45 to 43, and that frees up the $9,000 under their service plan. Okay, I see the little okay sign. So okay.
We did
additional
have one question here for Ken. Sorry. So Laura Spicer says, "Is there a form? How is the waiver used first? Do we request after a use step?" And so that's related back to the ARPA question again.
So, Laura, I guess I'm going to ask for some clarification. Is there a form? What are you referring to?
Well, I anticipate my client's cost might be just over 10,000, and so ARPA is an option for that. But you said that I thought I heard you say the waiver had to be, quote, used first, and then I didn't know how I do that first. And then ask, is there a step for then asking? Unless I have a misunderstanding there.
So are you asking, how do you reduce the current expenses?
I think so. Let me just clarify, Laura. This is what I'm hearing is that you're talking about submitting a home mod project that's maybe over 10,000. We would probably just want you to say in the request that you want to use waiver funds, and if it goes above that $10,000, they would like to also use ARPA funds to cover the rest of the cost. I don't think we need to see anything done separating those two. We'll still have it all billed together, but we'll be separating out the ARPA funds from the home mod funds. Is that correct, Ken?
Right.
Yes.
Yeah.
You just can't say, I'd like to use my ARPA funds first and then save the $10,000 of the actual waiver for later, right? So we expect that the waiver $10,000 comes before the ARPA would come into play.
Correct.
Yes, as the previous slide indicated, the underlying waiver benefit must be exhausted before you can get into ARPA funds. Okay.
Does that resolve your question, Laura?
Yes, thank you.
Okay. In short, really what we're trying to get to is how do they want to pay for the requested home modification? Waiver plus ARPA, waiver plus over the cap, just the waiver funds. That's really what we're trying to get to on that. And then ARPA, I see that question. Yeah, ARPA is for home modifications only. Okay.
And I think, Corey, we answered your question about does it need to be exhausted or allocated. Does that make sense to you now?
Okay, I see a thumbs up there. Okay. So that's what we wanted to discuss about the home modification process. There is another program that is available to residents of the state of Colorado. There is a tax credit for home modifications. It's HB 18-1267. And it's for tax years 2019 through 2023. And it does provide an additional amount of money, up to $5,000, for income tax credits. So what this is getting at is if you have a member that maybe all of their waiver benefits are exhausted, but they still need something done. If they choose to pay for an item out of pocket, they can then come to the state and apply for a home modification tax credit. And this would go against their income tax liability. So if somebody does not pay any income taxes to Colorado, there's nothing for this credit to go against. But if somebody does have an income tax liability and they meet all the criteria, they would do this. And that is out on the DOLA website, the Department of Local Affairs website. You would access that through housing, and it'll say on the left side, home modification tax credit. And there's a whole host of information, forms, etc. There's a separate email box that people send that information to that we look at. But keep in mind, the biggest distinction here is that for this tax credit to apply, the person is paying for items out of pocket and then coming to the state for an income tax credit. There are qualifiers on that. I believe the household income, it's indexed for inflation. I think it's up to $156,000 or $159,000. So household income needs to be below $159,000. They need to be residents of the state of Colorado, etc. There's all these. There's a pre-qualification survey. All this is out there, but we want to make that known. It maybe just in passing, if you come across somebody that's looking for home modifications, they're not sure what to do, this is available to them. And it could also apply for clients or members that exhaust all of their funds. They might be able to qualify for this program as well. And we would like to see people use this, take advantage of it, because if it's not used or taken advantage of, it could disappear, and we would like for it to stick around. Okay. And remember, this is not Medicaid. It's not federally funded. This is through the state of Colorado. Okay. And then here's some qualifications that we talked about. Now, one thing on this, though, is that the state legislature did expand the eligibility for this, where it used to just be one person per household. But now if there are multiple qualified individuals in a household, each person could qualify for up to $5,000. So maybe there's a husband and wife, or spouses, or a qualifying child, and all three of them have can meet these qualifications, and all three of them could apply for that tax credit as well. So it's really a nice benefit. We do see a lot of people take advantage of it. We tend to see a huge uptick in activity around tax time. If you can imagine that, when you're filling out your Colorado income tax, at the very end, there is a question that will ask if you did something on this, and that prompts people, jogs their memory. Oh yeah, we had a ramp installed or a bathroom, and then they'll pursue this program. Okay. Any questions for us that we haven't already addressed?
And I would like to circle back to Laura's question about the PTOT form that she asked earlier as well. Laura, I did want to let you know that the form that you're using is our current approved form. We did go through some stakeholder engagement, and we have a new form that's referenced in our training that's called the professional evaluation form. I think it's Health First Colorado professional evaluation form. We're working on getting that PDF worked out and fillable, and then we'll be posting that to the website and sending out a notice for that. So the form that you're using now that you're having text issues with, we apologize. We're aware of the issues with the form. I think what you have on there with the smaller and the bigger font is acceptable for us at this point, and we'll work on getting that other form posted for folks. And then Kenneth, there's a question in here that says, can DD people apply for the tax credit if they conduct home mods themselves or if a landlord does it for them?
Yes. So if you go back to that prior slide on the tax credit with the qualified individuals.
Sorry, I don't know if I can,
okay.
So
really it's, there's a pre-qualification survey that you fill out, and that's going to address the income, residency, disability, etc. And the person is really what this is, that tax credit is your normal everyday citizen of Colorado is doing the home modification process themselves. So instead of going through you as a conduit, they're doing it themselves. They actually provide us the contractor estimates, the pictures, a letter from their medical provider as to what their need is and why they need that, etc. So yes, the short answer is yes. As long as they qualify, they could come for that credit.
If the landlord pays out of pocket, the landlord isn't going to get that tax credit back. So it has to be the individual with the disability or their spouse or dependent that has a disability and they're paying out of pocket, and they also have a income tax liability.
Right. Yep. It's the person that needs the accessibility adaptation. Okay. All right. That is our contact information going forward. And again, down there in the bottom right corner, the dola_homemod@state.co.us. That's the generic box. Please send all initial home modification requests to that email address. And then once one of us actually picks up that request and starts running with it, we will communicate with you individually at that point. Okay. Anything else? Any other questions? Any issues, items of discussion, as long as we're all here? Okay.
All right. Well, thanks for joining us, everyone. Just as a reminder, if you have any questions, feel free to reach out to any of us in the future. And we will have these resources and the training recording posted on the website for you to review. Thanks, everyone.
Thank you.
Thank you. Bye.